One of the most important things for patients to do is choose a clinic very carefully and do research on the background of the clinicians there, and that they have a lot of experience, because what we do not want to do with ketamine is have harm happen, and that can happen because when patients are in an altered state and their clinicians are not familiar with how to deal with somebody with anxiety in altered state, or sadness, or anything that may come up, then the patient can be left feeling abandoned or very frightened. And part of that can be mitigated by talking to the patient a lot about what's going to happen, and then to be very, very careful with dosing. We're very cautious, and the art of the medicine.
Till today, you take a pill and you hope for a pharmacological effect downstream, but the pill or the medicine does not give you any experience.
Mm-hmm.
Whereas now, when you're doing ketamine work in our clinic, when you're under ketamine, you actually have a mild psycholytic trip. You have an experience, and that experiential, on top of the potential pharmacological, is very important.
Really powerful.
And on top of it, we have the psychotherapy.
Yeah.
So now we have this three-leg stool that is a new paradigm in medicine, and a lot of clinic are de-emphasizing or blatantly almost ignoring the experiential component, which I find over the past 8 years of doing this work that is very, very important and very, very beneficial for the patient.
Yeah, and like some places they are actually giving someone a benzo or something like that, so that there's basically no experience, and then instead of using that, if it's anxiety, whatever it's coming up, and using it in a way that's helpful and driven towards whatever issues that they're working on, they just ignore it, and so then that's a whole layer that's being
so that's
missed.
what I wanted to ask you. On top of being a psychiatrist, you're also a therapist and a psychedelic therapist. So from your point of view, how do you see the experiential and its contribution to the overall, this three-leg stool? How do you see this experiential play in the overall?
They can take that home and use it to make real changes in life, and not just it be some pharmacological thing that happened.
So the experience can change behavior, and that experiential element of ketamine treatment is, in my opinion, very important to the overall care of the patient in our clinic.
If you're ignoring that by either giving a medication to knock out the experience, or give them too much medication, then they get into this space which is no longer any plot, or it's basically just asleep with ketamine, and so much less useful. So I think the thing with our clinic that we're doing is we are like basically maximizing all of the effects.
We're really trying to individualize and tailor a customized setting for each patient and their individual needs.
And we also talk to the patient a little bit about the mindset that they're coming into, not watching the news, and kind of like being very mindful about the things that are happening on the day of treatment. One of the things that our clinic offers, which many clinics don't, is the option of having a therapist. And some patients come in and want to be very economical and just use ketamine from its pharmaceutical effects. But some patients may actually need more support. And we have the option of having a therapist. And what can often happen is that a patient, as they are going into their first experience, we see that they maybe need that support extra, and so we have quite a few therapists who have been CAP trained.
I think that adding psychotherapy to the ketamine infusion, i.e. ketamine-assisted psychotherapy, we not only allow the client to capture the experiential into a therapeutic kind of capsule, but then also follow up during the integration session with the therapist to implement those insights that came during the treatment.
Which is one thing I think maybe we haven't discussed yet, is the theories on the brain plasticity and the fact that you can use this time, 48, 72 hours after ketamine infusion, to really emphasize any work that you're doing with a therapist. And this increased brain plasticity is a real benefit that I think a lot of clinics are missing.
And the power of that brain plasticity over the long run is really powerful.
Yeah, and it's probably some folks in the literature have read about the default mode network and anxiety, and that gets damped down under ketamine, just like meditation does. And so new connections that haven't usually been made are being made. And so that's a very fertile ground to plant a seed for change. We see a lot of different types of folks in clinic. Some have major depressive disorder, some anxiety, OCD, and PTSD, trauma. And in your experience over the years, you've seen a lot of different types of folks too.
Yeah, and adding from the addiction perspective, in our clinic we see many people that are coming in with an underlying addiction, and obviously we know that addiction doesn't happen in vacuum. There's some underlying other mental health component, PTSD and depression or anxiety, and so we see the ketamine working on twofold with the group of addiction. One, the pharmacological underlying and experiential, obviously, but the underlying help for any type of underlying mental health condition like depression and anxiety, but also from the addiction, we see reduction in alcohol consumption, we see reduction in craving, and in many ways, ketamine, being an NMDA antagonist, is very close to the pharmacological effect that acamprosate, which is one of the medication we use for alcohol use disorder, that seems to help to reduce any type of craving and alcohol consumption.
Yeah, so then it's synergistic, the way that it's working together. Yeah, I think it's expensive, but it can be very, very valuable because of combining all of these different elements. You have the medication, pharmaceutical effect, you have the therapist, you have the brain plasticity, and the way all of that's working together, even though it can be costly, can be life-changing for some folks.
Yeah, transformative.
Yeah.